नमस्कार। हमारे सभी दर्शकों का हम स्वागत करते हैं आज के इस संस्करण में, इस कार्यक्रम में जिसका नाम है आपका विश्वास हमारा प्रयास। और आज हमारे साथ हमारे जो एक्सपर्ट्स हैं, मैं उनसे आपका परिचय करवा दूं। हमारे साथ आज हैं प्रोफेसर सुबोध केसरवानी, डायरेक्टर सेंटर ऑफ ऑनलाइन एजुकेशन, और डॉक्टर भारत भूषण, डायरेक्टर स्टूडेंट सर्विसेज सेंटर।
नमस्कार।
और मैं आप सबकी होस्ट डॉक्टर भावना गुलाटी, मैं असिस्टेंट डायरेक्टर हूँ स्टूडेंट सर्विसेज में। तो जैसा कि आप सब जानते हैं, इग्नू ओपन एंड डिस्टेंस लर्निंग के क्षेत्र में पिछले 37 सालों से बहुत कंट्रीब्यूशन कर रहा है। बहुत सारे पायनियरिंग काम किए हैं हमने, लेकिन ऑनलाइन एजुकेशन में अभी पिछले 2-3 सालों से ही शुरुआत हुई। 2019 में हमारा सेंटर फॉर ऑनलाइन एजुकेशन शुरू हुआ और उसके पीछे आई एम श्योर बहुत मेहनत, बहुत सारा विजन लगा। तो हम आज इन सब चीज़ों के बारे में जानेंगे। हम जानेंगे कि कौन से प्रोग्राम्स हैं जो ऑनलाइन माध्यम से इग्नू ऑफ़र कर रहा है, और जो स्टूडेंट्स हैं, जो हमारे ऑनलाइन लर्नर्स हैं, वो किस तरह हमसे जुड़े, उनको क्या लाभ मिल रहा है ऑनलाइन प्रोग्राम्स से, और उनका भविष्य किस प्रकार से ऑनलाइन लर्निंग से प्रभावित होगा। तो मैं शुरुआत करती हूँ, आपको लेके चलती हूँ डॉक्टर सुबोध केशरवानी के पास। मैं पहले बताना चाहूँगी डॉक्टर सुबोध केशरवानी के बारे में हमारे सब लर्नर्स को कि वो ना सिर्फ सेंटर फॉर ऑनलाइन लर्निंग के डायरेक्टर हैं, बल्कि उनका 22 वर्षों का विशाल अनुभव है टीचिंग और रिसर्च के क्षेत्र में, और टेक्नोलॉजी एनेबल्ड लर्निंग के क्षेत्र में बहुत सारे डोमेन्स ऑफ मैनेजमेंट में उन्होंने काम किया। वो प्रोफेसर ऑफ कॉमर्स भी हैं, स्कूल ऑफ मैनेजमेंट सर्विसेज, स्कूल ऑफ मैनेजमेंट स्टडीज़ इग्नू, उससे भी जुड़े हुए हैं। और क्योंकि उनका इतना अनुभव, इतना रिसर्च रहा है इस क्षेत्र में, तो उन्होंने मैसिव ऑनलाइन ओपन ऑनलाइन कोर्सेज भी डेवलप किए हैं, जिसके बारे में हम उनसे जानेंगे अभी थोड़ी देर में। साथ ही उनका बहुत सारे पब्लिकेशंस हैं टू हिज क्रेडिट, which we will request him to let us know in what areas he has worked and how that has helped him develop the programs and contribute to the growth of our learners and of IGNOU as an institution. Also, he has because of all the work, the wonderful work that he's been doing, he has been awarded the IT Innovation and Excellence Award of 2012 in the field of ERP solutions. So, Professor Kesharwani, a very warm welcome to you on this program. And as I said in the beginning, since IGNOU started in the ODL mode, and now over the last 2-3 years we've been working, we've started online, not only introduced, but we've actually we are making big strides, I must say. So I would like you to take us through this journey as to how the vision came up, what was the background to the setting up of COE.
I think you have little bit brief about what exactly the IGNOU is doing. If we go into the backdrop, we see IGNOU considered as a people's university. So if you talk more about it, I think we are into the hybrid age. And when you talk about hybrid age, I think you have to talk about the brick and mortars way of learning, as well as the contemporary learning, which we usually call the click and mortar system. So this kind of the format which had come up initially, we were emphasizing more on the stereotype learning which was going on. But again, the way IGNOU has started in 1985, I think that is something which need to be appreciated, because it was the only university in the world which was started without chalk and duster in 1985. So we have, and the USP was the self-learning material which we have developed. So the beauty behind the programs and the courses developed by our intellectual capital was emphasizing more on this self-learning material. So this is we usually call the one of the quadrants. So if I am going to talk more about the online education, I think the current format which we are using. So it's very true that in 2019 this center was formulated under the able leadership of our Honorable Vice Chancellor, Professor Nageshwar Rao sir. After a certain time, we in 2020 we started with 2 programs as a pilot project, and later on it become 12, then 16, then 18, and if you talk in July 2022, I think we have 41 programs in our basket, and this program is equipped with masters, with bachelors, certificate and diploma. So the lot of variation is going on, and it's in varieties of areas, in humanities, in science, in foreign languages, and management, commerce. So these kind of the things are going on. So uh, we are using our own learning management system. I will throw a light on what exactly the learning management system is, because when you talk about the electronic learning, when you talk about the virtual education, I think somewhere you have to disseminate this in a virtual format. So
Right.
virtual format is nothing but you are in touch with your learners, not in a physical manner, but with the technology. So technology is working as a intermediary, working as a backdrop, and this is where the learning management system is going to play a very important role. So the open source platform which we are using, that is Moodle. With the help of that, we have developed this learning management system, and it is quite customized and following the 4 quadrant approach. So when you talk about the 4 quadrant, I think the first quadrant talks about the video, the graphics, the animation, the multimedia. Then you have self-learning material, and then the assessment and interactions, and finally the examination. So if you go into the backdrop, you find out that IGNOU follow the 3-tier approach. That is the headquarters, then regional centers, and the learner support centers. So, and in between the various the divisions are there, like student support centers are there, which is playing a very important role and work as a intermediary between the program coordinators, between the faculty and the learners.
Right.
So what exactly the beauty of this online program is that students are admitted in a online, and and everything from underneath to pinnacle governs through this mode. So we admit student online, then disseminate our process through online with the help of this learning management system, and then assessment, interaction, and then finally the examination, which I am going to talk in a more elaborative manner, that how the
Yes.
proctored exams are going to be conducted, and either it could be the center proctored or remote proctored. So, and finally, and end of the day, once a student complete the examination process, they get the degree in a technological manner, in a digital mode, with the
Right.
help of this blockchain technology. So this is something which could be a USP of the university, that from the very beginning, from scratch, we talk about all those aspects, and then disseminate or facilitate our learners with that. So this is somewhat our deviation, as when we talk about uh, the the ODL programs, and comparing with the online programs. And good part is that the flexibility, and the modality is there, modular approach is coming up, and the way things are changing right now, we are more emphasizing on the academic bank of credit. So the credit things had come up. We will see that how the national education policy, vis-a-vis the tertiary education, which we usually call higher education, is talking more about this aspect. So that is where the role of the IGNOU is very pivotal, because we talk about the credits, learner get the credits, and transfer the credits in the academic bank of credit, and then finally when they accomplish the particular credit which requires to get the bachelor's degree or master's degree,
Right.
they get the degree. So this kind of the phenomena is coming up, which we usually call the need of an hour.
Right. Thank you. Thank you so much, Professor Kesharvani. We have now, after listening to you right now, we have a general overview, and I think more than the viewers, I am very excited that I'll get to learn a lot from this 1 hour session today. Before we move ahead with you, I will also take my learners to Dr. Bharat Bhushan, who's our expert from the Student Service Center. Um, a lot of our learners, I'm sure, they have seen Dr. Bharat Bhushan in our earlier episodes. For those who have joined our program today, I will introduce you to Dr. Bharat Bhushan. He is not only the director of the Student Service Center, he is also a member of the Board of Management of IGNOU, and he was also the director of the Distance Education Council when it was housed in IGNOU, and also He has worked with NEPA, and prior to that, he has been in various capacities in MHRD and in IGNOU, in DEC, UGC. He has also worked with the Distance Education Bureau in UGC, and um, also he has contributed for the last 27 years of his rich experience. He has contributed to the growth of not only this institution, but also a lot of students are benefiting from his experience, as he is the director of student services now, and the students' needs are being catered to under his able guidance. Dr. Bharat Bhushan, a very warm welcome to you also on this program. I would, as Professor Keshavani mentioned just now, that NEP 2020's vision is what IGNOU is trying to take forward. So I would like to ask you, we know that the NEP 2020 is laying a strong emphasis on online learning and on digitalization. Where do you see IGNOU coming in? How do we, contribute to the vision of the Government of India?
Thank you, Dr. Bhavna. And my own behalf also, I welcome the viewers who are watching this program today. And at the same time, I would like to request our viewers, students, stakeholders to connect with us on the given telephone lines which are, running in the bottom of your screen. While we say that IGNOU, as far as IGNOU is concerned, IGNOU is a very pioneering, a very unique university in the complete landscape of our country. University was established with a specific, motive when in higher education, the opportunities for higher education was very difficult as far as conventional university is concerned, because we know the intake in conventional universities is very limited.
That's true.
And to cope up the demand of higher education, and that too with the, as far as economies of scales are concerned, we have to be viable in a country where, country like India, where most of the population lives in, with very limited resources. So IGNOU has played a wonderful role as far as democratization and of higher education, as well as the reach of higher education is concerned. I think it has been proven during last 37 years. We have very recently, on 19th November, we have celebrated our 37th Foundation Day of the university, and where we look back that how we have been performing. And as I have been, saying in every platform, that our students are our ambassadors. They are, making us felt in every nook and corner of this country. As far as this country and then abroad also, the nature of the university is like this, that we have the territorial jurisdiction within the boundaries of this country, and then we have been empowered by the central government to have the reach across the borders also, our political borders. So we have our presence in more than 22, 23 countries in Southeast Asia, Middle East, and in Africa continents. As far as this new education policy 2020 is concerned, I think IGNOU in this area also, IGNOU has been a leader. When 2020 new education policy was introduced, and it was in public domain to be implemented by the higher education institutions in India, IGNOU was one of the beginners. We adopted new education policy, our board of management adopted it in toto, and to implement the new education policy, we have created a special center which will evaluate the, as far as the implementation part of new education policy is concerned, and they will develop the guidelines how we can go ahead in implementation of new education policy. And I'm very happy to share with the viewers and listeners uh, that in new education policy, when we talk about digitization of the education and online part of education is concerned, in this area also IGNOU has played a very important role, and since very beginning we have been working in this direction, and it is the concerted efforts of our honorable vice chancellor that center for online education was established way back into 2019, and under the able guidance of our vice chancellor we have been, as of now today we are offering more than 40 programs,
40 years,
right
41.
from certificate to diploma, undergraduate, and then postgraduate. And I'm very happy and want to congratulate also Professor Kesharwani ji that under his able guidance we are able to offer MBA program, which is highly specialized program in online mode. All this has happened because we have state of art technology, we have the subject expertise up to it's all specialization. We have I understand that we have all 4 5 6 specialization under the management operations and research, marketing management, human resources, finances, like this. So under all these specializations we are offering it, and that too with the revised syllabus. And above all, I would like to share this importance aspect also, that our program, whatever program IGNOU has been offering in traditional ODL mode as well as in online mode, they are approved by the concerned regulatory bodies of the country. We know that as far as technical and professional programs are concerned, UGC, All India Council for Technical Education is the apex body. Our programs which are technical or professional in nature like MBA, MCA, they are recognized by AICT, and all other programs which are general or vocational or professional like nursing program,
Right.
and vocational program, they are also approved by Nursing Council and Vocational Education Council. So I think it is a very unique university as far as IGNOU is concerned, and with the help of this program, Aapka Vishwas and Hamara Prayas, which was launched by Honorable Vice Chancellor on 2nd September 2022 this year. This was the objective of this program, that we will be able to connect with our learners with the help of this program, although we have many other platforms which are being used to reach our students with different formats. But this program was also conceived in this way that we will be introducing every time with one school of studies and the programs which the school has been offering, and we are lucky enough along with our viewers and listeners that we are able to invite our directors, and in that series today we have Professor Kesharwani ji, who will apprised us, our learners, about the beauty of online education program, which is a very recent and very highly specialized area as far as imparting higher education in a country like India.
That's true.
So, as far as our digitization is concerned, new education policy is concerned, we know that if we go side by side, that there are many things which are first in IGNOU, and they have been included in new education policy 2020 as it is. For example, if I say that the modularity was one of the
Yes.
biggest thing which when IGNOU conceived its programs way back in 1985. Modularity means if a student completed some credits in his program, if it is a duration of 2 years or 3 years, he will be awarded some certificate, diploma, advanced diploma, or undergraduation. And if a student has completed his graduation, and he want to go for further higher, for post graduation, his graduation part will be, if with the addition of some more courses, he will be awarded some PG also. So that was the beauty of IGNOU's program, and we feel so proud when it was recognized widely all over India and that too by the planners, education planners of our country. Then our honorable Prime Minister has also, have been, advocating the digitization of, in our own fields, like in finance and in education. So as far as the digitization is concerned, in this area also IGNOU has been playing a very pivotal role right from the beginning. I remember during 90s, the course material which was developed by the university in self-learning mode, it was kept available on a e-gyan course format by scanning it, so that the students can read it anytime online also. So I think it is a wonderful step which university has been taking, and we are going ahead as far as new education policy is concerned.
That's true. That's so true. And I'm sure our viewers would agree with us that all of this that Dr. Bharat Bhushan just said, the students who contact us at the Student Services Center, they are constantly given feedback, and they are reminded about how to utilize the valuable resources that IGNOU is making available for all of you, for your benefit. And we are constantly making efforts and trying to reinvent ourselves, um, make more efforts to be at your service. As we say, education at your doorstep. So we are trying to do just that. Now, there is another thing that comes to mind. Since the Center for Online Education was started in 2019, and the world was unfortunately hit by a pandemic in 2020.
Yes, yes.
We've seen how online education has been taken up in a big manner, even by the people, learners in those sections of the society where technology enabled learning was actually not even conceived of, not thought of. It wasn't even a far-fetched dream. And now school children and learners in all age categories, all social groups know that online learning is a thing. So is it a silver lining in the clouds, sir?
Yes, I think there is a very famous quotation which says that blessings in disguise.
Right.
So sometimes we learn many things from our past mistakes, and maybe the situations are adverse, and we have to move against the tide, but we have to win the battle. So I think Honorable Vice Chancellor sir have taken a very good initiative, that launching and taking a risk to start with two programs. And as I have quoted that in 2020 we have started with two programs, and gradually we have gone up. So then it was a need of an hour. If you go into the education 6.0, I think, which is the latest trend right now, which talks about the hybrid learning and the combination of the brick and mortar system, the click and mortar system, as well as the trend is talking about, because online education is a need of an hour right now. And you can't because the mandate had been changed. The as far as the learners are concerned, for them the important is that how much they are skilled. So education along with the skilling is going on parallelly, which national education policy is talking about. We have seen that how Dr. Bhushan have emphasized more on national education policy, and national education policy have given a mandate about the ICT, the information communication technology usage in education, because if you want to cater the masses, if you want to, because IGNOU mandate is we have right now the 4 million learners, and how it could be, because somewhere we are using the technology in the backdrop. So integration is something which is very important aspect, and technology is coming up. And you have seen that Honorable Vice Chancellor sir have quoted in a very beginning that we follow 3S, that is Samarth, and then you have Swayam, and then you have Swayam Prabha. So You have very well quoted in the very beginning about the massive open online courseware. I think this is something which was started with the openness thing, the open platform. So the whole world is right now talking about open, the OERs, open educational resources. IGNOU is also working in this direction. We have seen that, you know, a decade back we have started with a product called EGNOU, so which is nothing but an archive of our self-learning materials. And this is not confined to the bona fide learners of IGNOU, but to the other learners who are, situated across the board. So a good part is that, the learners are accessing the IGNOU content, which was occurs in the past also. We have seen that, the IGNOU self-learning material was adapted by the civil services aspirants.
Right.
They mug up the content, and then, the learning is going on. So this kind of, the format was developed, and the intention is very clear that we have given full flexibility to the learners. They can migrate from online to ODL, and ODL to online. So this kind of privilege is also given to the learners, and many things are coming up. I am talking about, the Swayam platform, which was uh,
I'm Harshada Gupte from the Pune Regional Center.
Very, very warm welcome. Hello, we can hear you, Alpana ji. A very warm welcome to our program. Hello.
Hello.
Yes. Please speak to our experts. We would like to hear from you. Yes, please speak to our experts.
Hello, yeah. Can you
Yes.
hear me?
Yes, we can hear you. Please go ahead and ask your question.
I'm calling from the Pune Regional Center. I'm Harshada Gupte. I'm enrolled in the MA English online course.
Okay. Yes, please go ahead.
Okay,
Please go ahead.
thank you. Hello.
Yes, we can hear you.
You have not asked your question. You please repeat. Can you repeat
My
your question?
question is that my assignments have been submitted a little early.
Right.
My assignment has been submitted super early, so the problem is that I submitted it as the typed assignment, and now I'm unable to resubmit.
Maybe she means that she's unable to resubmit the soft
yes,
copy.
I think
Sir, this is S. Sonam calling from IGNOU Regional Center, Pune. The student has this query that she has submitted through the LMS portal the assignment, and while submitting, she was not sure whether the assignments were supposed to be sent handwritten or typed. Therefore, she has typed and submitted it, and I think she was given S grade. So, and she was advised to resubmit them in the handwritten format. So her question is that she is not in a position to resubmit them again in LMS portal because she has submitted already.
Okay, Professor Kesharwani, would
Thank
you like
you
to
and
take
over,
that?
sir.
I think what is the modus operandi in the ODL format, that if the learners have submitted the assignment, and for any reason they have not scored that much, they can again submit in another cycle. This is the procedure what we have. So the same procedure we are following over here also, that the learners can submit the assignment. If they have got the less grade, they can again get a privilege to submit the assignment in the next next cycle. So I think if there could be any issue, they can communicate with the regional centers, because this time all the regional centers, the 57 regional centers across the board are facilitating learner jurisdiction wise. So this is the good thing what we have, that the manner we used to in touch with our learners with the platform, in the same manner we are in touch with the online mode also.
Right.
So good part is that all things are governed through online. So the learning management system is equipped with the regional center's admin login also, and the moment you submit the assignment, it will automatically redirect to the respective regional centers, and regional centers takes the help of the academic counselors and get it evaluated. So this is the procedures, and if you have any query, I think you drop a email, we will definitely reciprocate accordingly.
Okay, can we also tell them the email ID just to reiterate?
I think one assistant is sitting over there in the control room.
Yeah.
He has taken note of his number from where she is contacting. I think we will revert back to her from our office.
Definitely.
But this is offshore that as Professor Kesharwani Sahab has said, that as far as submission of assignments are concerned, there are certain guidelines to submit the assignments. One is this, that they have to write the assignment in their own handwriting.
Right.
We cannot submit the typed assignments. So this is one. Second, that from time to time we have been issuing the alerts for our learners that this is the last date for submission of the assignments, and then sometime we extend the last date for for the benefit of our learners who are not able to submit the things within time. But the flexibility, sometime it becomes a illness also. Distance education and online education is a flexible system which which should be taken as not as the thing that it can be stressed. If we stress something up to its last limit, it will break. So this will be, I have been requesting to my learners, IGNOU students, stakeholders, that please don't wait for last date. This is one. Second, when students submit their assignments online, then they hope that I have not received any communication whether I have successfully submitted my assignments or not. This is the beauty of technology, that once you submit your assignment, if you have not received back any email, that means that your mail has been bounced. That means if you have not received that bounce statement, that means your assignments are submitted.
One more thing I want to add, Dr. Bhushan, I think when the learners enrolled in the online programs through LMS, and the portal name is iop.ignoonline.ac.in, so the learners can go over there, and with the help of they will get dedicated login and password. So with the help of that, the moment they enter it, they get a dashboard. So these dashboards are equipped with all the status. I think if the learners have submitted the assignment, they get the status of submission over there. So the submit status is there. On the other hand, we give privilege to our learners. Sometimes what happen, since they are not acquainted with the technology, or they are not acclimatized with the learning management system, so maybe accidentally they upload the wrong material. I think sometimes they upload the question paper, or sometimes they upload the half assignment, or maybe the assignment is of 10 pages, they uploaded only 5 pages. So that kind of the rectification is the power has been given to the regional centers. So regional centers can provide them a flexibility that they can get other option to submit the assignment. So this kind of flexibility is there, but again it's not applicable. What you have said, that flexibility should not be take as a granted. So it can be asked from the learners that they are facing if learners reciprocate that I have faced this issue, definitely we are going to rectify that. So these kind of the thing is there, and there are certain FAQs, there are certain checklists which we have floated on the learning management system. So because since this is a new format, so the learners sometimes face issue in accessing. So we try to facilitate either with with the help of these FAQs or the checklist, and in between we do a lot of orientation induction. So the program coordinators, the course coordinator, and regional centers, the all regional center across the board are involved into it. So we are in one-to-one touch with the learners. So this kind of thing is going on, and whatever the induction and orientation are governed, we create an archive of that and put it on the YouTube channel, so that they can cross verify, they can go it and see that where they are lacking and how they are going to do that. So gradually we are doing on somewhere, we are, because when you talk about the offline programs, when you talk about offline courses, I think the learners have an opportunity to visit to the regional centers and get the problems resolved over there. So one thing I want to make it clear, that online is as good as the offline. The only thing is that there's no such physical touch, but again you can be in touch with the regional centers. I think we have a huge list of 57 the persons who had been deputed in each regional centers, and these people are have their email number, their mobile number, and their name is flashed on the portal, so they can in touch with them, and if there could be any issue they can write to director COE also. So as well as the student support centers, so automatically the mail can redirect to us and we will reply on the basis of that.
That's true. That's so true. So we have to say this to our learners, that we cannot stress the importance of utilizing your time well enough. There is flexibility, but it is for your benefit. It is not to be used as a last resort. At this moment, we would like to take a short break, and then we'll be back with you with a few more areas that we would like to touch upon in today's program. Stay with us.
Are you a fresh graduate? Do you want to fulfill your educational aspiration by pursuing higher education in various interdisciplinary and multidisciplinary areas like environmental science, environment and occupational health, philosophy, sustainability science, folklore and culture studies? If yes, the School of Interdisciplinary and Transdisciplinary Studies offers various programs like Master's Program, Graduate Program, Postgraduate Diploma, Certificate and Appreciation Program. The school offers 5 Master's Program. Master of Science, Environmental Science. The eligibility criteria for MSc Environmental Science is Graduate in Science, BTech, BE, Agriculture Graduate, Forestry Graduate and Veterinary Graduate. School also offers Masters in Environment and Occupational Health, Masters in Sustainability Science, Masters in Philosophy and Masters in Folklore and Culture Studies. The eligibility criteria for these 4 Masters program is graduate in any discipline. The school also offers various socially relevant and need-based PG Diploma program like PG Diploma in Sustainability Science, PG Diploma in Environment and Occupational Health, PG Diploma in Folklore and Culture Studies and PG Diploma in Migration and Diaspora Studies. The school also offers PG Certificate in Climate Change and Avshist Prabandhan mein Praman Patra. The school also offers 2 doctoral programs, PhD in Environmental Science and PhD in Interdisciplinary and Trans.
वेलकम बैक। हम ब्रेक पे जाने से पहले प्रोफेसर केशरवानी से ये समझ रहे थे कि किस तरह से ऑनलाइन स्टूडेंट्स को भी इग्नू के वास्ट रीजनल सेंटर्स और लर्नर सपोर्ट सेंटर्स का सपोर्ट मिलता है, और इस वजह से हम चाहते हैं कि हमारे सभी स्टूडेंट्स, ऑनलाइन स्टूडेंट्स भी इस पूरे नेटवर्क का भरपूर फ़ायदा उठाएं। अब जैसे हमने बात करी हमारे इंडिया में इस पूरे नेटवर्क के बारे में, तो मैं ये भी जानना चाहूँगी अभी प्रोफेसर केशरवानी से कि हमारे जो इंटरनेशनल स्टूडेंट्स हैं उनके लिए हमारी ऑनलाइन लर्निंग किस तरीके से कंट्रीब्यूट कर रही है, और दूसरा कि जो ऑनलाइन लर्निंग में जो 4 क्वाड्रेंट अप्रोच है इसके बारे में आप हम सबको बताएं। मैं भी सीखना चाहूँगी इसके बारे में, मैं बहुत उत्सुक हूँ ज़रूर।
देखिए मैडम, ऐसा है, पहले तो मैं इंटरनेशनल स्टूडेंट के बारे में बात करना चाहूँगा
जी।
अब देखिए कि पीआईज़ का जो कॉन्सेप्ट है पार्टनर इंस्टीट्यूशंस का, वो इग्नू में बहुत पहले से है, और डॉक्टर भूषण जी ने भी बताया कि हम हमारी प्रेजेंस 22 कंट्री में है। सो वी आर कैटरिंग द इंटरनेशनल स्टूडेंट, दैट इज़ वेरी ट्रू। बट ऑन द अदर हैंड आप देखिए कि हमने जो है कई इनिशिएटिव्स लिए हैं। जैसे गवर्नमेंट ऑफ गोवाना के साथ हमने टाई अप किया, गोल्ड प्रोग्राम लॉन्च किया विच इज़ स्पेशली फॉर द साउथ अमेरिकन स्टूडेंट, और साथ में अभी हमने ई विद्या भारती स्टार्ट किया है विच इज़ अ इनिशिएटिव बाय द मिनिस्ट्री ऑफ एक्सटर्नल अफेयर्स, एंड रादर वी वुड से कि वो पैन अफ्रीका आपने सुना होगा, पहले चलता था, सीज़न 2 है उसी का। उसमें भी हमारे पास वी हैव गॉट अ गुड नंबर ऑफ स्टूडेंट। मुझे लगता है कि 2100-2200 लर्नर्स जो हमारे पास उसमें भी हैं, एंड दिस इज़ प्योरली मूविंग थ्रू द लर्निंग मैनेजमेंट सिस्टम। सो और साथ में हमारा जो इंटरनेशनल स्टूडेंट हैं जो हमारे प्रोग्राम में ऑनलाइन में भी एनरोल्ड हो रहे हैं और ओडीएल में भी हैं जो इंटरनेशनल स्टूडेंट हैं, तो इंटरनेशनल प्रेजेंस हमारी है और बढ़ती जा रही है। और देखिए द वे वी हैव migrated, or we have a paradigm shift from offline to online. I think in the coming years you will find out that IGNOU have a good presence in the international jurisdictions. तो इसका फ़ायदा मिलेगा, क्योंकि जो उसकी यूएसपी क्या होती है, देखिए ऑनलाइन एजुकेशन का एक अपना मतलब यूएस प्लस पॉइंट भी है, नेगेटिव पॉइंट भी है। प्लस ये है कि आपके पास एक सॉफ्टवेयर होता है, एक वर्चुअल सॉफ्टवेयर होता है जिससे आप certain you can make your presence in the particular location. So this is the beauty the software have, and with the help of this software you can be in touch with the learner. जैसा मैंने पहले बताया कि हम 3 years फॉलो करते हैं, और हमारा जो सामर्थ्य जो ERP सिस्टम है उसमें लर्नर हमारा एनरोल्ड होता है, एंड within some few days, I think they get the login name and password. So with the help of this login and password they get the dashboards, they get their dashboard क्या होता है, एक तरह से उसका अपना एक वर्चुअल वो फॉर्मेट होता है जिसमें he or she can visualize that what exactly their working will go on. तो सबसे अच्छी चीज़ क्या है कि
सर मैं आपको इंटरप्ट करूंगी, आरसी कोलकाता की तरफ से एक कॉल आ रहा है हमारे पास, हम वो कॉल ले लेते हैं। हेलो।
हेलो।
हाँ जी, स्वागत है आपका हमारे प्रोग्राम में।
हेलो।
हाँ जी, बताइए।
मेरी बात भावना मैम से हो सकती है?
हाँ जी, बोल रही हूँ।
गुड इवनिंग भावना मैम।
गुड इवनिंग
मैम, मुझे एक हम्बली रिक्वेस्ट है आप लोगों से मैम
जी,
कि मैम मेरा असाइनमेंट का नंबर अभी तक पुट नहीं हुआ है मैम।
अच्छा।
हाँ, और मेरा रजिस्ट्रेशन का वैलिडिटी भी जून 2022 खत्म हो चुके हैं मैम, और मेरा क्वेरी का एग्जाम क्वालिफाई मैंने कर चुका है।
कौन सा प्रोग्राम?
ना होने की वजह से मेरा तो अभी मार्कशीट में ग्रेड कार्ड में कुछ परमुटेशन मिल ही नहीं पा रहा है।
कौन सा प्रोग्राम है आपका? आप अपना परिचय दें।
हाँ, मैं रविंद्र शर्मा बोल रहा हूँ।
अच्छा जी।
हाँ, मेरा प्रोग्राम का नाम है POF।
ओके, ठीक है। तो आप ना असाइनमेंट सबमिशन की बात कर रहे थे ना आप?
हाँ मैम, मैंने असाइनमेंट सबमिशन ऑनलाइन कर दिया था मैम।
कब किया?
अभी कंप्लीट नहीं हुआ है मेरा ग्रेड कार्ड में।
ओके, ठीक है। डॉक्टर भूषण, वुड यू लाइक टू टेक दिस क्वेरी? हाँ
हेलो।
जी, बोलिए।
हेलो मैम, एक और क्वेश्चन था मुझे।
जी बोलिए।
हाँ मैम, मैंने ये मुझे सर से क्वेश्चन पूछना था सर। मैम,
हाँ जी, पूछिए।
हाँ, मुझे भरत सर से रिक्वेस्ट है और सुबोध सर से भी रिक्वेस्ट है कि हम लोग ग्रेजुएशन अपना इग्नू से ही किया है मैंने,
जी
और मैंने मास्टर डिग्री भी इग्नू से ही किया है। बट मुझे बीएड करना था मैम। बट बीएड के लिए ऐसा कुछ है ही नहीं कि मैं बीएड कर पाऊँ मैम। उसमें एक्सपीरियंस सर्टिफिकेट मांगता है। एज अ जो लोग स्टाफ ऑलरेडी टीचर हैं वो लोग बीएड कर पाएंगे। तो क्या हम लोग फ्रेश जो लोगों ने इग्नू में 3 साल ग्रेजुएशन में दिया, 2 साल एमए में दिया, तो क्या हम लोग बीएड नहीं कर पाएंगे मैम? इसके लिए मुझे बहुत दिनों से मेरे सारे फ्रेंड से रिक्वेस्ट था, आप लोग से भी रिक्वेस्ट था कि कुछ ऐसा कर दीजिए मैम कि आने वाले जो फ्रेश स्टूडेंट है जो इग्नू में न्यू एडमिशन ले रहे हैं उन लोगों को भी बीएड करवाए मैम। ये सिर्फ सरकारी जो लोग टीचर हैं उन लोगों के लिए बीएड का प्रावधान दिया गया है इग्नू में। प्लीज मैम, इसको लेकर भी कुछ कदम उठाया जाए। जो फ्रेश एडमिशन लिए हैं उनको भी बीएड करने का मौका दिया जाए इग्नू से, क्योंकि हम लोगों ने टोटल 5 साल इग्नू में दे दिया मैम। तो
जी
5 साल के बाद हम लोगों को कहीं से डिस्टेंट एजुकेशन और कोई एक्सेप्ट करता नहीं है, और बाहर करने में बहुत पैसे लगते हैं। इग्नू में कम पैसे में मिनिमम हम लोग कर सकते हैं मैम। तो इसके लिए 2 मेरा रिक्वेस्ट मैम, एक तो मेरा असाइनमेंट को लेकर और
जी।
एक मुझे मैम बीएड के लेकर। मुझे ही नहीं, ये सारे भारत के सारे स्टूडेंट होंगे जो बीएड करना चाहते हैं इग्नू से, पर वो लोग कर नहीं पाते क्योंकि वो लोग एज अ असिस्टेंट टीचर नहीं है मैम। मुझे भरत सर से भी, मुझे सुबोध सर से भी और आरसी के रीजनल डायरेक्टर से भी, सभी से यही रिक्वेस्ट है मैम कि हम लोग जैसे फ्रेश स्टूडेंट जो बीए और एमए करने के बाद बैठे रहते हैं उन लोगों को भी बीएड करने का मौका दिया जाए मैम।
जी, हमने आपकी क्वेरी सुन ली है। डॉक्टर भारत भूषण यहाँ पे हैं, वो जवाब देंगे।
मैं रविंदर जी, आपका शुक्रिया, आपने हमसे बात की। आपके 3 क्वेश्चन हैं। पहला क्वेश्चन है असाइनमेंट्स के लिए कि आपने असाइनमेंट सबमिट किए हैं लेकिन आपका अभी ग्रेड कार्ड कंप्लीट नहीं हुआ है, तो उसकी आप चिंता मत कीजिए। आपने अगर ग्रेड कार्ड अपना असाइनमेंट सबमिट कर दिया है तो वो अभी प्रोसेस में होगा। आपको पता है कि इग्नू बहुत बड़ी परिवार है। मोर देन 3.5 मिलियन हमारे स्टूडेंट्स हैं और ये हमारी ब्यूटी भी है। और जब थोड़ी बहुत जो देर होती है वो इसीलिए होती है कि बहुत बड़ा सिस्टम है। आपको पता है कि 22 लाख, 23 लाख, 25 लाख असाइनमेंट्स एक सेशन में आते हैं और उनको इवेलुएट कराना भी एक बहुत बड़ा चैलेंज होता है। तो अगर आपने असाइनमेंट सबमिट कर दिए हैं तो आप बिल्कुल चिंता ना करें। आपके डिटेल्स हमारे कंट्रोल रूम में नोट कर लिए हैं और हम इसको चेक करा लेंगे। आपसे हो सकता है हम बात भी करें आपके टेलीफोन पर, जिससे आपने अभी बात की है, ताकि आपके दूसरे डिटेल ले सकें। तो असाइनमेंट की तो आप चिंता छोड़ दीजिए। सबमिट हो गया तो हम उसको वी विल सी टू इट को जल्दी से हो जाए और आपका ग्रेड कार्ड भी अपडेट हो जाए। दूसरा क्वेश्चन आपका शर्मा जी रहा कि आपने इग्नू से बीए किया और एमए भी किया और अब आप बीएड करना चाहते हैं जो नहीं कर पा रहे हैं। मुझे इनफैक्ट थोड़ा पीछे लेके जाऊंगा तो इग्नू में जो पहले बीएड होता था वो इन सर्विस टीचर्स के लिए होता था, और क्योंकि ये डिस्टेंस मोड का बीएड होता था तो इन सर्विस होना ज़रूरी था, क्योंकि उसमें जो टीचिंग एक्सपीरियंसेस वगैरह होते हैं वो इनबिल्ट होने चाहिए थे। तो वो सिस्टम ने बीएड कराने को इसी तरह से ही कंसीव किया था और इसीलिए उसका हमें अप्रूवल भी मिला था। अप्रूवल जैसा आप जानते हैं कि सभी प्रोफेशनल कोर्सेज़ के लिए, वोकेशनल कोर्सेज़ के लिए, टेक्निकल कोर्सेज़ के लिए एक अपेक्स बॉडी होती है जो रेगुलेट करती है सिस्टम को। तो जहाँ तक टीचर एजुकेशन की बात है, जो आप बीएड करना चाहते हैं, बीएड को रेगुलेट करने के लिए नेशनल काउंसिल फॉर टीचर एजुकेशन होती है। टीचर एजुकेशन की जो काउंसिल है उन्होंने ये जो प्रोविज़न था वो डिसकंटिन्यू कर दिया कि ओनली वो स्टूडेंट्स जिन्होंने 2 साल का रेगुलर जेबीटी बेसिक टीचर ट्रेनिंग कोर्स किया हुआ है और वो एनसीटी से रिकॉग्नाइज्ड है, वही लोग इग्नू से या किसी भी दूसरी यूनिवर्सिटी से जो डिस्टेंस मोड से बीएड कराते हैं वो बीएड में एडमिशन ले पाएंगे। तो इसमें बहुत कुछ हम कर नहीं पाएंगे, क्योंकि ये तो हमारी एक बहुत अच्छा प्रोग्राम था। हमारे पास एक फुल फ्लेज स्कूल ऑफ स्टडीज़ है जिसको हम स्कूल ऑफ एजुकेशन कहते हैं, जो एलिमेंट्री टीचर एजुकेशन और बैचलर ऑफ एजुकेशन, एमएड, इस तरह के प्रोग्राम्स कराता है। तो हमें तो ये नुकसान हुआ ही है, लेकिन जहाँ तक यूनिवर्सिटी के एफ़र्ट्स की बात है वो हमारे ऑन हैं कि हम किसी तरह से ज़्यादा बच्चे जो हमारे यहाँ से बीए करते हैं वो बीएड कर पाएँ। दूसरी बात, जो तीसरा जो क्वेश्चन आपने बताया था कि इग्नू के बीए को एक्सेप्ट नहीं करते, तो रविंदर जी ये तो आप प्लीज़ रीचेक कीजिए कि इग्नू का बीए को कोई एक्सेप्ट नहीं करता, तो आप प्लीज़ हमें बताइएगा। इग्नू के सभी प्रोग्राम्स, चाहे वो सर्टिफिकेट हो, डिप्लोमा हो, ग्रेजुएशन हो, एमए हो, इवन रिसर्च डिग्री प्रोग्राम्स हो, वो सभी मैंने आपको शुरू में ही बताया कि हमारी रेगुलेटरी बॉडी से अप्रूव्ड हैं। और जहाँ तक बीए की बात है, आपका बीए जब आप रेगुलर मोड से अगर बीएड करना चाहेंगे, जो अब आपके पास एक ऑप्शन है, क्योंकि डिस्टेंस मोड से बीएड अब कहीं से भी नहीं हो पाएगा अगर आपने एलिमेंट्री टीचर एजुकेशन रिकग्नाइज्ड जो एनसीटी के रिकग्नाइज इंस्टीट्यूट से नहीं किया है, तो बीएड डिस्टेंस मोड में तो एडमिशन आप इग्नू ही नहीं कहीं से भी नहीं ले पाएंगे। लेकिन बीएड आप रेगुलर मोड में जरूर कर पाएंगे ऑन द बेसिस ऑफ द डिग्री विच यू हैव अर्न फ्रॉम इंदिरा गांधी नेशनल ओपन यूनिवर्सिटी। मैं रविंदर जी के लिए एक बात और बताना चाहूँ कि यूजीसी, जो कि जनरल हायर एजुकेशन की अपेक्स रेगुलेटरी बॉडी है भारत में, उन्होंने टाइम टू टाइम इस तरह के नोटिफिकेशंस दिए हैं कि कोई भी डिग्री, डिप्लोमा, सर्टिफिकेट जो डिस्टेंस मोड से एक्वायर किया है किसी भी ओपन यूनिवर्सिटी से या डिस्टेंस एजुकेशन इंस्टीट्यूशन से, उसकी डिग्री में और कन्वेंशनल यूनिवर्सिटी की डिग्री में कोई फ़र्क नहीं है। ये मैं आपको बताऊं, एक तो अक्टूबर 2013 का ही ऑर्डर है, जब मैं यूजीसी में था, व्हेन आई वाज डायरेक्टर इन यूनिवर्सिटी ग्रांट्स कमीशन, डिस्टेंस एजुकेशन ब्यूरो। एक नोटिस उस वक्त का है, और अभी रिसेंटली भी यूजीसी ने एक नोटिफिकेशन निकाला जिसमें ये कहा गया है कि जितनी भी क्वालिफिकेशंस किसी डिस्टेंस एजुकेशन इंस्टीट्यूशन से या ओपन यूनिवर्सिटी से, इंक्लूडिंग इग्नो और एनी अदर इंस्टीट्यूशन से किया है, तो उन डिग्रीज़ में कन्वेंशनल मोड की डिग्री में कोई फ़र्क नहीं है एज़ फार एज़ फॉर हायर एजुकेशन एंड एम्प्लॉयमेंट इज़ कंसर्न। तो ये आप बेचिंता रहिए, आपको संशय नहीं होना चाहिए इस बात का। आप अगर सोचते हैं आपके पास, तो आप इग्नो के बीए के बेस पर बीएड किसी भी कन्वेंशनल मोड से, किसी भी कन्वेंशनल मोड की यूनिवर्सिटी से कर सकते हैं।
तो आशा है कि हमने रविंद्र शर्मा जी की जो भी क्वेरीज़ थी उनका जवाब दे दिया है। और मैं अब आगे बढ़ती हूँ। हमने प्रोफेसर केशरवानी से हमारे ऑनलाइन एजुकेशन के बारे में बहुत कुछ जाना। अब सर, मैं जानना चाहती हूँ कि हमारा जो एग्ज़ामिनेशन सिस्टम है, ऑनलाइन एग्जामिनेशंस के बारे में थोड़ा बताएं, क्योंकि जो भी छात्र ज्वाइन करेंगे हमें ऑनलाइन से, वो ये सिस्टम समझना चाहेंगे।
बिल्कुल समझना चाहते। पहले तो मैं वो डॉक्टर भारत भूषण जी की बात को थोड़ा एंडोस करूँगा
जी।
कि जो रिकॉग्निशन की बात है, उसमें अगर एक ऑनलाइन प्रोग्राम में एक हमारा लर्नर एडमिशन लेता है तो इट इज़ एज गुड एज ऑफलाइन प्रोग्राम। रिकॉग्निशन दोनों में बराबर है
जी।
और आप माइग्रेट भी कर सकते हैं। इफ़ द सिलेबस एंड करिकुलम इज सेम, यू कैन माइग्रेट इन द सेम प्रोग्राम हैविंग ऑफलाइन नॉमेनक्लेचर। सो आप देखेंगे कि अगर एक मैं एग्जांपल लूँ, अगर बीकॉम जी एक प्रोग्राम है जो सीबीसीएस फॉर्मेट में है, तो बीकॉम ओएल एक ऑनलाइन प्रोग्राम है। तो इस तरह का मतलब वो उसमें सुविधा हमने अपने लर्नर्स को दी गई है। रिकॉग्निशन की बात हम कर रहे हैं, तो रिकॉग्निशन देखिए दोनों की बराबर है। आप अगर उसमें भी आप 4 क्वाड्रेंट फॉलो करते हैं, एक प्रोसीजर फॉलो करते हैं, आप जो है वहाँ पे एडमिशन लेते हैं, फिर आप असाइनमेंट जमा करते हैं, उसके बाद टर्म एंड एग्ज़ाम्स का फॉर्म भरते हैं और एग्ज़ाम देते हैं। इसमें भी वही मॉडल है। व्हेन यू टॉक अबाउट द प्रॉक्टर्ड एग्जामिनेशंस, आई थिंक हमने ऑनलाइन में बल्कि सुविधा थोड़ी ज़्यादा है कि हम असेसमेंट और जो हमारा असाइनमेंट का असेसमेंट है उसको हम ऑनलाइन करते हैं और फ्लेक्सिबिलिटी लर्नर्स को देते हैं। जैसे डॉक्टर भूषण जी ने कहा, हम उसमें जो है आप असाइनमेंट को लिख के, हाँ, हैंड रिटन लिख के हमारे पोर्टल पे अपलोड कर सकते हैं एंड इट कुड बी इवेल्युएटेड बाय द एकेडमिक काउंसलर्स। सो दिस इज़ द थिंग विच इज़ देयर। और साथ में जब प्रॉक्टर एग्जामिनेशंस की हम बात करते हैं, तो प्रॉक्टर एग्ज़ाम्स देखिए कराने के पहले हम जो है लर्नर से ऑप्शन लेते हैं। जो ऑप्शन जो है कंप्यूटर बेस्ड टेस्ट होता है जिसको हम सीबीटी बोलते हैं, और पेन एंड पेपर होता है। सो वी आर गिविंग ऑप्शन टू
आपको
लर्नर्स।
मैं थोड़ा सा इंटरप्ट करूँगी, माफ़ कीजिएगा। हाँ जी, हमारे पास कॉलर हैं, तो हम उनसे बात कर लेते हैं। हेलो।
हेलो।
हाँ जी
पूछ
बोलिए।
सकती हूँ?
हाँ जी बोलिए।
क्वेश्चन इज कि ऑनलाइन फॉर्म जो है एग्जाम फॉर्म
जी।
वो ऑनलाइन कोर्सेज के लिए आ ही नहीं रहा है. वी कांट सी एनी ऑनलाइन फॉर्म्स फॉर ऑनलाइन स्टूडेंट्स.
Professor Kesharwani,
If
please.
you talk about December 21 term and exams, we have already conducted the exams due to COVID. It was conducted in September 2022. For July 22 and December 22 students, I think the option is going to be given to the learners in due course, and these option will ask for the computer based CBT and pen and paper. The learners will take one of the option, and accordingly the things will go on afterwards. So you have to wait. If you falls under the June 22 term and December 22.
Actually, I'm enrolled to January 2022. But unfortunately,
If
the
you are
exam
right,
form for
if
the
you are
online courses has not been
no, that is
available.
fine. If you enrolled in January 2022, I think you are going to give your term and exams in June 2022, right? So for June 22 and for December 22, I think we are going to collaborate that, and in due course you will get the option from the SED, that is Student Evaluation Division, and once you take any one of the option, you have to, your journey for examination will start afterwards. So you wait, we will in due course we are going to reciprocate. I think if you are online learners, you can see the dashboard, and you can also revisit the IGNOU portal. There you will get the details.
Okay, I think we have been able to answer that query. We have another caller on the line with us for our experts. Hello.
Hello.
Yes, please welcome to the program. Please ask your question.
Yes, thank you, madam.
Yes, please go ahead and ask your question, please.
मंच पर आसीन सभी एक्सपर्ट को मेरा प्रणाम. आज का जो कार्यक्रम है बहुत अच्छा है, रेलेवेंट है और समय की मांग के अनुसार बहुत अच्छी इंफॉर्मेशन सभी के साथ शेयर की गई है. और मेरा एक छोटा सा सुझाव है
जी
कि जैसे अब हमारी यूनिवर्सिटी ऑनलाइन प्रोग्राम्स के बारे में काफी अच्छा काम कर रही है, काफी नए नए प्रोग्राम्स जुड़ रहे हैं और हजारों की तादाद में विद्यार्थी हमारे ऑनलाइन प्रोग्राम्स में इंटरेस्ट ले रहे हैं.
जी
तो हमें इसी तरीके का एक ऐसा सिस्टम बनाना चाहिए जिसमें हमारी बहुत सारी एक्टिविटीज ऑटोमेटेड हो जाएं और तो हमारी हर एक्टिविटी का एक जो शेड्यूल है वो अगर संभव हो तो पहले से ही फिक्स होना चाहिए. और अगर हमारे स्टूडेंट्स के पास एक इंफॉर्मेशन रहेगी कि इन डेट्स से इन डेट्स के बीच में उनको ये एक्टिविटी करनी ही करनी है, तो इससे हमारे विद्यार्थी मिनिमम ड्यूरेशन में अपने प्रोग्राम को पूरा कर पाने में सफल होंगे. ये प्रोग्राम बहुत अच्छा है और मैं आयोजकों को इस प्रोग्राम के सफल आयोजन के लिए अपनी तरफ से बहुत बहुत साधुवाद, बहुत बहुत बधाई देता हूँ. शुक्रिया, नमस्कार.
नमस्कार, थैंक यू सो मच.
ये डॉक्टर शर्मा जी थे, हमारे ही साथी हैं इग्नो रीजन सेंटर 1 से, रीजनल डायरेक्टर्स. आई थिंक ऑनलाइन एजुकेशन में उनके सुझाव थे जो हम डेफिनेटली, क्योंकि जो रियल प्रैक्टिस है डिस्टेंस एजुकेशन में, ऑनलाइन एजुकेशन में, वो हमारे रीजनल सेंटर्स पे प्रैक्टिस होती है. और ये बहुत अच्छा सुझाव है जो हम अपने ध्यान में रखेंगे. और शर्मा जी, आप बिल्कुल, हम कंसर्न हैं इससे कि हमारे विद्यार्थियों को कोई परेशानी ना हो. हम इस सुझाव को बहुत अच्छे से इस पर कंसंट्रेट करेंगे.
जी तो हमारे प्रोग्राम का समय समाप्त होने ही वाला है. मैं जाते जाते सिर्फ एक चीज़ प्रोफेसर केशरवानी से बोलना चाहूँगी कि हमारे दर्शकों को बताते चलें कि ऑनलाइन लर्निंग का फ्यूचर क्या है. हमारे जो लर्नर्स हम ऑनलाइन मोड से सीखना चाहेंगे वो अपने भविष्य में क्या देखें.
देखिए, फ्यूचर तो बहुत ब्राइट है. जिस तरह से पैराडाइम शिफ्ट हो रहा है, लर्निंग चेंज हो रही है, पीपल वांट टू लर्न मैनी थिंग्स इन अ शॉर्ट स्पैन, इन अ प्रिस्क्राइब ड्यूरेशन. आप देखते हैं कि लर्नर्स जो है जॉब में रहते हैं, साथ में ऑनलाइन कोर्सेज कर ले जाते हैं. रिकॉग्निशन एक बहुत बड़ा इशू था, एफिलिएशन, एक्रेडिशन बहुत बड़ा इशू था जो ख़त्म हो रहा है. अगर मैं वेस्टर्न वर्ल्ड की बात करूं So you have seen that there are a lot of online programs which are going very well. And there are some good brick and mortar universities. They have shut down their the academic business and converted into online. So India में इस चीज़ को समझा गया. I think IGNOU had taken a big initiative in this direction, and we are gradually doing it. But there are certain constraints. जैसे कि मैंने बोला कि there are certain practical courses which require the physical touch. The lab based the training is need to be required. उसके लिए इग्नू ने सुविधा करी है. रीजनल सेंटर्स हमारे बहुत एक्यूप्ड हो रहे हैं, जहाँ पे हमें लगता है कि लेबोरेटरी कोर्सेज है, प्रैक्टिकल कोर्सेज हैं, तो वहाँ पे हम जो है उनको फिजिकल मोड में ले आते हैं. सो दिस काइंड ऑफ फ्लेक्सिबिलिटी इज़ देयर. सो दैट इज़ द रीज़न we emphasize more on the blended learning model, the hybrid learning. So hybrid learning is not talking more about the online way of learning, but somewhere if we require we go for offline. और इंडिया एक बहुत बड़ा मतलब कंट्री है जिसमें आपने देखा होगा कि अर्बन पॉपुलेशन भी है, रूरल पॉपुलेशन भी है. Some are good with the technology, the broadband and bandwidth. Somewhere we find out that it is lacking. So we need to have this kind of blended model. So IGNOU had given full flexibility to the learners that anytime they can migrate into offline and online vice versa. So ये एक अच्छी चीज़ है जो फ्लेक्सिबिलिटी की दिशा में एक नया कदम है. और मुझे लगता है IGNOU जब स्टार्ट हुआ तो from the day one we talks about the flexibility, and that is the thing which we are doing over here.
Right. Thank you so much. I would like to thank both our experts, Professor Subodh K. Sharwani from the Center for Online Learning, COE, and Dr. Bharat Bhushan, SSC. और मैं आपकी होस्ट डॉक्टर भावना गुलाटी फ्रॉम स्टूडेंट सर्विस सेंटर. आप सबका हमारे साथ जुड़े रहने के लिए बहुत बहुत धन्यवाद. हम आपसे मिलेंगे अगले महीने के दूसरे सोमवार को. तब तक के लिए अपना ख्याल रखिए एंड कीप लर्निंग.
थैंक यू.
A warm welcome to IGNOU. If you are creative, if you can write well, and if you can visualize, mass communication is the correct career option for you. I am going to talk about postgraduate diploma in journalism and mass communication, which is also the first year of MA program in journalism and mass communication. So any learner who has done a postgraduate diploma in journalism and mass communication is eligible to take admission straight away into the second year of our master's program in journalism and mass communication. Duration to complete this program is minimum 1 year, and because we have this inherent flexibility in distance education system, you can take up to 3 years to complete this program. The minimum eligibility criteria for taking admission in this program is bachelor's in any discipline. To give you a glimpse of what are the various components of this program, we begin with telling you what mass communication is, what are the various areas, various branches of mass communication. Then we go on to tell you about the various reporting techniques and beats of reporting, followed by media ethics, the principles, the codes of conduct that you must follow, and we also focus on the writing skills and editing skills for print media. Now this program comprises of 8 courses of 4 credits each. 25% of the entire program is practical based. So we have 6 theory courses and 2 practical courses. This program is so designed so that it will be able to make you more employable in the market. So it helps you build a career in print media, in radio, television, new media, as well as the allied subjects of mass communication, which could be media marketing, advertising, public relations and corporate communications, event management. This can also help you become an entrepreneur in areas like photography or having your own production house and so on. So I hope that you will be excited to join this program, and we will be waiting to welcome you here in IGNOU.
Welcome to this session of teleconference. Today we will be dealing with the students of Community Health Certificate Program, that is CCH, and topic we have chosen today from BNS 042 and Block 2 Unit 2, that is antenatal care. So today we will be discussing in detail about the antenatal care, and before we start the topic I would like to inform all the students that as the examination is just nearby and you have to appear in the exam having MCQ questions only, and the duration of the examination is only 2 hours, and in 2 hours you will be answering 70 questions. All will be MCQs. So with this information, all the best to all the students, and if you have any query during the session you can ask your queries. And welcome to the session. And today to discuss this topic we have with us Dr. Namita Chopra. Madam is MBBS and MD in gynecology and working in the Dr. RML hospital. Welcome you, ma'am, for this session. And today I think this session will be very lively, and topic is also very important because you will be having will be a kind of revision for all of you, because you must have covered this topic during your counseling sessions also. So we will be covering about what is antenatal care, what is the importance, why do you need to give antenatal care to mothers, and what will be the effect or impact if the good antenatal care is given from your side, because you are dealing all the patients in the health and wellness centers where you come across many problems, and sometimes you find it difficult to meet the needs of the various kind of patients. So you just clarify your doubts as well as you revise this topic today. So I would like to first of all ask you, ma'am, what is mean by antenatal care, and what is the importance of doing, and what are the aims of doing antenatal care?
So antenatal care basically means a systemic supervision of a pregnant woman. It happens at regular intervals, fixed time intervals in a woman's pregnant period. And it aims at maternal well-being, fetal well-being, and it kind of monitors the fetal growth.
Yes. As madam has rightly said, you have to do systematically. It is not that a woman has come to you and you start giving the your advices. You have to go systematically, and to go systematically you have to ask about what is happening with the antenatal woman and in which stage of pregnancy she is. So during the pregnancy, the care you are giving is the antenatal care. And if we see the importance, please.
Importance, the first and foremost plan of an ANM or a medical officer during examining a pregnant woman is to prepare her for birth, to identify whether the pregnant patient is fit for further examinations at subcenter basic level, or she has some high risk factors for which the woman needs to go to a higher center. It provides quality care for both maternal and fetal well-being. Besides identifying the early risk factors, it also addresses the woman on personal grounds. What all queries or what all doubts or anxieties she has with relation to pregnancy, what are her future plans. In fact, we should take it as an opportunity for family planning and further care also.
Yes.
Apart from maintaining other basic aspects of pregnant woman's life in relation to her hygiene, her sanitation, her overall physical and mental well-being.
Yes, as madam has rightly pointed out that it is not just the care at that point of time, it is for the future also, because she has to plan many things in advance, where she will be getting the delivery to be happen, and what will be how she will take care of the newborn baby. Sometimes a woman is primary and then she does not know how to even handle the baby. Yes. So she has to know all these things. For that, to prepare the mother for all these future consequences, antenatal care is very important. And if we see the objective do you please highlight the objectives of antenatal care?
Yes. The primary objective of antenatal care is to detect high risk pregnancies and stratify each pregnancy, and in the beginning only we have a plan in front of us whether such pregnancy goes to a basic health center or a higher specialized center. To our ultimate objective again is to reduce maternal morbidity and mortality and reduce infant mortality and morbidity. You must have seen in past 20 years, centrally sponsored schemes have helped a lot in bringing down maternal mortality rate and infant mortality rate. What used to be a 3-digit figure earlier, about 20-30 years ago, it was more than 150 maternal mortality rate. Now we have come down to close to 103, and few states are performing really well. Maternal mortality has gone down to 70 to 80 in states like Karnataka, Tamil Nadu. So
but there are some states with having high mortality rate, so we need to work more towards those states like Uttar Pradesh and Bihar and Madhya Pradesh, etc. So there we need to work more. At the same time, when you prepare the mother for future, that means you are able to reduce the anxiety which she has with this change in her physiological processes. So you give them the advices in such a way that you can remove their anxiety also at that same time. And also you teach the mother about the newborn care, the child care, about immunization. You are preparing for the future. That is why the anxiety is lesser and she will progress well in the pregnancy. So if we see the various component of antenatal care, so we will discuss in detail what are the various component and what is the first component of antenatal care.
So the first and foremost component is early registration. You know, few women have this conception in mind that we can visit the doctor as and when required according to the complaints they face. But this is not the right way of approaching a pregnancy. A pregnant woman is advised to seek medical care as soon as she finds out that she's pregnant, either by doing a urine pregnancy test or as and when she misses her period. So we expect a minimal standard of antenatal care in a country like India. We have minimum 4 antenatal checkups. The first visit has to be within 12 weeks or as soon as a woman discovers that she's pregnant. The second week ideally should be between 14 to 26 weeks. The third visit should be between 28 to 36 weeks. The fourth visit should be between 36 weeks and term. This is the basic level of care we wish to dispense. But apart from these 4 visits, a woman is advised to follow up in the antenatal clinic as and when she's told by the doctor, according to the signs and symptoms she has.
At the same time, she need to have 2 doses of tetanus toxoid as well as 100 tablets of iron and folic acid also are being started from after 12 weeks of pregnancy.
So normally we give 2 doses of tetanus toxoid. The first dose is given at her first visit when she gets registered. The second dose should be 4 weeks after the first dose, at least 1 month prior to the expected date of delivery. Apart from TT immunization, a very important aspect for a country like India where nutritional deficiencies and anemia is so common is folic acid and iron supplementation. Every pregnant woman should receive at least 100 milligrams of elemental iron for at least 180 days. Along with, she should receive 0.5 mg of prophylactic dose of folic acid in her first trimester. So folic acid also plays a very important role in pregnant period and even periconceptionally, before she conceives. Folic acid has a very important role in the neurodevelopment of the baby. So all females who are planning a pregnancy should ideally start folic acid dosage around 3 months prior to conceiving.
That means they can, prior to conception, they can start folic acid, and during first trimester also they can keep continuing folic acid.
We
So-
continue folic acid dosages till 12 weeks of pregnancy.
Yes, this is very important point here, because you can be asked question out of folic acid. Because we say normally that in first trimester no medicine is allowed, but then you have to see which tablet can be given even during first trimester. So name of that tablet is folic acid. So the student, you can remember that it can be a MCQ. Now if we see, like we have told that early registration is very important for the antenatal mother. So for that registration she need to come to the health center. But can she has some factors which can hamper her visit to the health center or seeking health services? So what can be the delays in getting the registration? If she is not able to reach, then how we will register her? So we have to know these factors also which are making her delay in coming to the health center for registration. Please highlight about these delays.
So in our society, what we observe as doctors, there are 3 levels at which the delays are being seen. The first and foremost is there's a level of hesitation at home front also. Like the female thinks that since I don't have any complaints at present, why should I visit the doctor right now? So delay in seeking health care is one of the common delays, and it's the first level of delay which we should address. So a basic level of awareness should be present in our society, that as and when you figure out that you are pregnant, you need to visit your doctor to have further information about your nutritional needs. What are you supposed to what diet plan, what all prophylactic doses you are supposed to follow. And one thing which we experience in tertiary care hospitals, which, like, we get referrals from periphery and primary health centers. Sometimes a woman delays her first antenatal visit, and later on the doctors figure out that the pregnancy was not even intrauterine. So the pregnancy was extrauterine, which we call as ectopic pregnancy. That can land any female in great trouble, because these pregnancies are not viable, and such woman is liable to land up in severe bleeding, shock, hemorrhage, which is life-threatening. So our basic aim in first visit is also to localize the pregnancy by means of ultrasound, whether the pregnancy is in right place or not, whether it's inside the uterus or it is outside the uterus, which we call as ectopic pregnancy. It's a very, these days it's a very common yet life-threatening conditions which the tertiary care centers are facing. So a basic level of understanding for the ANMs and doctors working at periphery is that they should not delay the first ultrasound of a pregnant woman.
Yes, and the second level of delay
Second level of delay is accessibility of a health center, of a healthcare center. In this, patients or attendants sometimes face difficulty in finding a transport channel to reach health center. So we should all be aware that centrally sponsored and state sponsored ambulances are available round the clock. Helpline numbers are 108, 102, and now under NHM there is public private partnership also. So private impaneled ambulances are also available. So you can always call up 102, 108 if you have trouble reaching the healthcare center, if you do not have a vehicle of your own. The third level is seeking a good quality care. So it is another aspect. It has many prongs to it. Sometimes the health centers are not fully equipped with maybe staff, resources, logistics, blood bank, OT facility. So here comes the role of all peripheral centers when to refer such cases. If the sub-center or PHC, a doctor sitting in a sub-center or PHC finds out that the case is beyond their scope, in terms of resources, manpower, logistics, blood bank, and OT facility, then they should not hesitate from referring the patient to a higher center. It should be a timely referral.
Yes. So as Madam has explained, there are 3 delays which can land up into many complications to the antenatal mother. So you have to remember these 3 delays and what all aspect of the health will be hampered due to these delays. So if you know that, then you are prepared to take care of these patients. Now another component of antenatal care is the essential component of antenatal care is the history taking. And when you are taking history, you must have done this practical in your supervised activities in the district hospital, and you must have studied many cases. So many of the aspects are just common. So how all we have to keep in mind about history taking of the antenatal mother.
So while taking history from a patient, we should first ask her age. Age is very important because both teenage pregnancies and pregnancies occurring after 35 years of age, we consider both age groups as high risk. So age is important, where she lives, rural area, urban area, how far her residence is from the health center, it is also important aspect. Then her last menstrual period. You should ask about proper menstrual history, whether her cycles were regular or not. This helps us in calculating the exact period of gestation. Then whether it is her first pregnancy or whether she had previous childbirths or abortions, we need to know that. How her spacing of pregnancy has been there. Sometimes too closely spaced pregnancies are also high risk. Yes. Woman may not be nutritionally ready for a next pregnancy. Then we should not forget about medical history, past medical history. For example, if a patient is having common disorders which we face these days, thyroid disorder, diabetes, hypertension, some surgical procedure she has had in the past, it is also important. Then her family history is equally important. There are, as we all know, there are few diseases which run in the families, which has a genetic basis. For example, diabetes, hypertension. Few conditions in which there is a birth defect in the fetus. Sometimes a sibling might be affected, maybe mental retardation or some birth defect, which increases the risk in the coming offspring. So family history is also important. Then dietary history is important.
And sometimes woman has bad obstetrical history in which she has repeated abortions. And if you have not taken that history, so you will not come to know that what had happened to her in the past. So these things are very important for the present pregnancy. So you can handle at your level, or you can refer the patient rather than waiting in your facility itself. So apart from that, there are some desirable component of antenatal care like blood group and the RH type is very important. We will discuss them in detail, and it is also a routine test nowadays, VDRL, and the also the, can you tell something VDRL, what all, why we do this test, as students will be able to have that.
So we have 4 viral markers which we consider as basic blood panel for a pregnant woman. That includes HIV. We all know HIV, hepatitis B, hepatitis C, and the 4th component is VDRL. So VDRL is a screening blood test to detect syphilis viral infection in the mother. So it has 4 stages. In very advanced stage, it can affect both mother and the fetus. The fetus can be affected in terms of intracranial like mental abnormalities or skin abnormalities, heart defects. Sometimes the pregnancy turns out to be non-viable also. So it's a viral infection which can systemically involve the health of the fetus.
Yes, and we also say normally it is a sexually transmitted disease also.
Yes, it's sexually
Syphilis and
transmitted.
viral disease, sexually transmitted disease, communicable disease. So you should remember the basic of this terminology. Then there is also a tie up with the nearest ICTC or PPTC centers for the rapid test, as you have told, for HIV testing, and there should be referral and management of positive cases, and like hepatitis B and blood sugar testing is also a routine test nowadays, because you see the prevalence of diabetes is on the higher trends, and gestational diabetes is also very common. So this is are important. Another component of the antenatal care is the counseling. So can you tell, you must have counseled many antenatal mothers, so can you just give some of the examples?
Yes. So, counseling again has many aspects to it. First, we should discuss with the woman the importance of institutional delivery. The statistics have improved a lot in India. We have more than 80% institutional deliveries today, but still there are sections of population who do not see the need to go to a healthcare center for delivery. Sometimes they call nurse, or we come across a lot of die handle deliveries also. So we need to reinforce the importance of institutional delivery. Secondly, we need to counsel not only the mother but the husband and the family members, because it's a joint responsibility. Raising a child is never the sole responsibility of a mother. So the whole family needs to be prepared for it. And we need to discuss with them the nearest health center they will be seeking antenatal care from, and one higher center we should be always prepared for, where the patient and attendants can go at times of emergency when the case goes beyond the scope of a basic health center.
Yes.
Besides that, we need to educate the woman and her family members about few danger signs at which the woman should not wait at home. She should directly report to the obstetrician and managed further at the institutional level. For example, any episode of bleeding or leakage, any episode of if a woman faces decreased fetal movements, or she has high BP records or very high deranged sugar values, or she has history of seizure disorder and she comes across uh, another seizure episode during pregnancy. So these are few conditions where a woman should not wait and immediately report to the nearest health center.
And also it is required for promoting the family planning method in case she is eligible to be adopting some
Yes, these all
spacing method, or
these
the
all are opportunistic meetings with the family and of course the patient herself, to educate them regarding birth spacing, future family methods they need to bring into.
Yes, and apart from that, now after looking after these components of antenatal care, let us see how to examine the antenatal mother.
So, examination of a pregnant woman should always be in a private space. Ensure the woman that she does not, ensure the woman and take her into confidence, so that she can talk about any factor which she cannot discuss in front of her family members. She can talk it in private with the doctor. You should make the woman as comfortable as possible, and maintain confidentiality in case a woman wants to discuss something in person. So while examining the woman, first you have to ask the woman to pass urine, so that it's better to it's more accurate
Yes.
to examine the period of gestation.
As
So
you have
before-
rightly told before also, that it is very important to ask the age of the mother, number of order of pregnancy, and the birth interval between the two, in case she is second gravida. And then how do you calculate the expected date of delivery? Can you just explain to our students?
Okay, so it's called Naegeli's formula. It first we find out the first day of her last menstrual period, and we from that day itself it is 9 months plus 7 days. That gives us the expected date of delivery.
So sometime they get this question also, what is the full form of EDD and how do you calculate EDD? So you should be very clear about this formula, and what is the significance also you should tell the mother what is the significance of calculating, so that she remains prepared beforehand, that now 1 week here or there she has to prepare everything for the delivery and later on. So then we can ask about the normal symptoms during pregnancy. What are the normal symptoms, or it is easy for them to identify a pregnant woman? What can be the
So, the common symptoms a woman faces during pregnancy, especially in the first 3 months, are nausea, vomiting. Occasional vomitings, we take it as normal only. It's because of the hormonal changes the female is facing. Usually, the dietary intake decreases in the first 3 months, and instead of gaining weight, a woman tends to lose weight. So, you have to tell the patients not to panic or worry about, because actually a woman starts gaining weight after around 20 weeks of pregnancy. In the beginning, she might lose 1 or 2 kgs due to vomitings and dehydration and decreased dietary intake. She can have heartburn, dyspepsia. Dyspepsia means indigestion, and decreased bowel movements, constipation. They are all hormonal induced changes which will gradually subside on their own. We just need to reassure the patients. In case a woman has excessive nausea, then we have few medications which we can give, which are safe during pregnancy, anti-motility agents like tablet doxynate. So there are few medicines which are safe to give during pregnancy. We see according to the condition and give.
apart from normal symptoms, there are some symptoms which are an alert for the health worker to send that to the higher facility or to manage properly. So can we discuss that also? What can symptoms can be of?
So again, these are danger signs. We are reinforcing them again, because while we encounter these signs, we don't have to wait further. A woman does not have to stay back home. She has to go to a first referral unit, higher center, where a specialist care is present at the level of a medical officer or a doctor. Because after encountering these danger signs, the case no longer comes under an A&M, it comes directly under medical officer. So if a patient has severe vomiting to such an extent that she is dehydrated, drowsy, not taking anything orally, or if she has persistent fever, or she has leakage or bleeding per vaginum, or decreased or absent fetal movements, or she has palpitations, chest pain, breathlessness. Sometimes a woman might be having heart disease, which gets figured out in pregnancy, because heart disease is one condition which aggravates during pregnancy. You might not even know that the woman has some heart lesion or heart disease. It gets increased during pregnancy. And if a woman has excessive breathlessness on slight work only, chest pain, tiredness, swelling all over the body, then these are few signs that patient might be having some heart problem. Again, next a very important high risk factor in pregnancy which we encounter is pregnancy induced hypertension. It's one of the most common causes of referral to tertiary care centers. When the patient has high BP records associated with headache or epigastric pain, or sometimes even fits, seizures.
Yes, and it is as a health worker, you can easily measure the blood pressure of the patient, and if you find that it is high BP, and at the same time you find some generalized edema, or you check the urine, it is very easy to check urine for albumin using the dipstick method, and if you find just 2-3 things which is in your domain, you can do this assessment, and you find something abnormal in this parameters, you can immediately refer the this pregnant woman to higher health facility. Apart from that, there are the abdominal examination, and it is also important to take the monitor the abdominal growth. so for the progress of the fetal growth, and check the fetal lie and presentation, and also you auscultate the fetus heart sound of the woman. Then there are component of abdominal examination. Would you highlight abdominal examination?
Yes. So why do we do an abdominal examination? The primary aim is to find out whether the fetus, which position the fetus is placed. Is it in a vertical axis or a horizontal axis? 90% of the pregnancies are in longitudinal axis. Then in longitudinal axis, what is the exact position of the baby? Whether the head is the presenting part or the buttock is the presenting part. So if the head is in the presenting part, then the woman can theoretically deliver normally. But if some other part is the presenting part, if it's buttock or the feet of the baby are the presenting part, then the person is a candidate for cesarean delivery. Secondly, we need to find out the progress of fetal growth. So fundal height. What is fundal height? It is the upper extent of the uterus to which level we can palpate, whether it's above the umbilicus, and if it's above the umbilicus, how much finger breadth above the umbilicus. So by serial monitoring of the fundal height, we can get a rough idea whether the baby is progressing in terms of weight or not. Then we also palpate for the amount of liquor, whether the liquor is, it's a very subjective finding, whether the liquor is sufficient or not. Sometimes if we feel the abdomen full of fetal parts only, and if we are not able to feel the cushion around the fetus in the form of fluid, then we say the pregnant woman might be having oligohydramnios. Oligohydramnios means the scanty liquor, deficiency of liquor. Then these all findings are confirmed on ultrasound.
Yes. And we can just revise major investigations a pregnant woman undergoes, like a pregnancy test, as we have discussed. Complete urine analysis is important. Stool examination is very important to find out if there are some worms in the stool. So even if you give high rich diet or iron diet or high protein diet, but if there are worms, then it will not be of any use. So first of all, it is very important to rule out through stool examination whether there is a woman need deworming or not, and complete blood count, serological examinations, and the blood grouping, and RH determination, and rapid diagnostic malarial test for malaria test. These things are important to rule out any fever or malaria. And apart from that, now we are going to plan and prepare for the birth. So it is very important for you to tell the mother what is the birth preparedness, what all components are covered in the birth preparedness. Let us see the registration. We have discussed already that during the first visit of the mother, she has to be registered, and then identification for the place of birth we have covered. Then institutional delivery to be encouraged in the mother, and we have to identify and arrange for the transport, and there is any support of the people available, that has to be identified, and also identify the blood donor in case it is required. So again, there is a complication preparedness, we have also covered that. Now let us see the high risk cases. It is very important for you to identify high risk cases. So what is high risk cases, and how do we identify these cases?
So high risk cases are all those cases which have some medical comorbidity associated, or some obstetric complication has occurred, which cannot be managed at a basic sub-center or a primary health center level. A minimal of community health care center, or a sub-district or a district hospital, or a medical college institute should be involved in such cases, because these cases require round the clock OT facilities, blood bank facility, ICU care, maybe mechanical ventilation, and a comprehensive specialty care where we involve other disciplinaries too. For example, a physician, a general surgeon, or maybe a super specialization facility like cardiology, urology. So these cases are not to be managed at basic obstetric level.
So you can list what are the high risk cases,
Okay.
so that students can identify them, and while even taking history of the patient, they are alert that if it is the age, then it is high risk or not.
Yes, yes. So starting from age, again I'm reinforcing, before 18 years of age, teenage pregnancies, or age above 35 years, we consider them high risk. Too closely placed pregnancies, especially in a previous cesarean case, we label as short interconceptional period if two pregnancies are spaced to less than 18 months of interval, because then in the next pregnancy there is a risk of scar rupture during maybe during labor, maybe during operating, which can be life threatening because it involves a lot of blood loss. So especially previous cesarean cases with short interval of pregnancies, these days there's a rising incidence of cesarean. So this is one of the very common high risk pregnancies which we at tertiary care centers are facing. So previous cesarean cases with short intervals, then severe anemia, or heart disease, or high BP records with end organ damage, or diabetes uncontrolled, those who require insulin. Then a few obstetric conditions which we might not have control over, like malpresentations, as I discussed earlier, presentations which are not cephalic. If some other fetal body part other than the head of the fetus is presenting in the cervix, or short statured women whose pelvis might not be adequate to deliver vaginally, or cases of adherent placenta. Again, this is one domain which has increased a lot, maybe because of rising incidence in cesarean deliveries. So these days what we are encountering is sometimes the placenta does not separate by itself during delivery. It gets adherent, it gets stuck to the wall of the uterus. In that case, the patient might bleed torrentially, leading to shock. So ultrasound is again a very good modality to diagnose it prenatally. So such cases again have to be referred to higher centers. Then all conditions like polyhydramnios, which have a high risk of cord prolapse during delivery, again it's a high risk obstetric condition.
So now let us, there are so many conditions in which uh, high risk, you have to identify women with the high risk. Now let us see, can we do something for the prevention of these things to happen, so that they take certain measures in such a way that you prevent or control some of the situations which are in your hands as a health worker. So what can be done for the prevention?
So the prevention does not actually start at the time period when the woman is pregnant. It starts even before marriage. So a woman of a reproductive age, maybe unmarried, should have a basic nutritional, a good nutritional status, and so that there are no micronutrient deficiencies in future. And one more approach which we should not forget is rubella vaccination of all reproductive age group females, so as to prevent rubella infection in the fetus. Rubella is again a viral condition which is blood-borne. It can cause mental retardation, heart defects, cataract, eye defects in the fetus. So the prevention is very easy. A woman planning to conceive well in advance should undergo rubella vaccination. At least 4 to 6 weeks gap should be there before conceiving. Then as soon as we find out that the woman is pregnant, we should pay attention to her iron folic acid prophylaxis, whether she's taking iron, folate and calcium. Calcium again is an area where a woman sometimes does not comply with. But it has repercussions in future when she bears her child, she can feel that there is weakness, musculoskeletal weakness, bone weakening in future. So apart from iron again is reiterated very categorically by all centrally sponsored schemes. But calcium, I would like to reinforce, a woman should not forget taking calcium also, at least twice a day, 500 mg, because the recommended daily allowance in pregnancy is 1200 milligrams. She should not take it at one go. Thousand, like these days there are preparations having 1000 milligram of calcium also, but it is not advisable to take high dose in one single go. It affects the absorption of iron, so it should be spaced out. And again, a woman should remember that she should not take iron and calcium together. Taking together hampers the absorption of each other.
So this is very important point, because sometimes we say you eat this, but
Yes, we
we
do not
forget
tell
to
about spacing. So
We
these are
don't.
micro
Yes.
points we should keep in mind, but yes, they have great significance.
Great significance. And even if you are taking calcium, you are taking iron, but still there is no effect, and then we come to know later that they were not taken correctly, so it is of no use. And, so it is very important that you have to keep a gap between the calcium and the iron. If you are taking calcium in the morning after breakfast, then you take iron in the night. I think that can be the, so that you are clear in your health education to the woman about calcium as well as about iron. And why not to take together? Because you know that if you are taking together, calcium will not get absorbed in the body, and then it is of no use of taking that kind of dose. So this is very important point. You have to keep a gap. Then
So apart from nutrition and iron calcium prophylaxis, other aspects are prevention of infection. A basic good level of hygiene should be maintained by the woman. And another aspect is early diagnosis of any possible birth defects. Again, there's a rise in the statistics related to birth defects these days, because maybe because of intake of some embryotoxic agents. These days there are so many toxic chemicals in the environment. The age of conceiving has also increased, late age of marriage, late age of conceiving. There are multiple factors involved, but yes, there has been a definite rise in the incidence of birth defects. So at tertiary level, we are among all routine antenatal investigations, we are also focusing on early NT-NB scan, where the brain matter and the spine of the fetus is observed sonographically in the 11th or 12th week of pregnancy, where we detect any possible birth defects at a very early stage. Next level at which you can detect is level 2 ultrasound. You should all know that this term, level 2 ultrasound, it's a comprehensive or a systemic examination of fetal parts head to toe sonographically to see for any gross congenital anomalies in the fetus. In case there is any abnormality in the fetus which might not make the baby survive for long if he comes to life, or if the mother does not want to take that risk of giving birth to a malformed baby, then an early decision needs to be taken. Then that pregnancy needs to be terminated in a timely manner. Earlier it was less than 20 weeks. Now a gazette has been passed that we can do it till 24 weeks of pregnancy. That is done when a medical board is constructed. There again, it has another angle to it. There it needs to be passed by 2 obstetricians. But yes, we do have a provision of terminating such pregnancies. So this is another aspect, timely detection of birth abnormalities in the fetus.
Yes, very important information. And now, if, as a community health officers, you are supervising ANMs or the ASHA workers in the field area or the rural area. So you should have better knowledge, and so that you are able to supervise them, you are able to guide these health workers in the field. So when we are meeting this patient at sub-center level, so there also we need to tell them some of the things, and you should all be clear what do you mean by prophylactic dose, what do you mean by therapeutic dose? So, as a health care worker or health community health officers, you should know these terminology: prophylactic dose, what do you mean by it, and chemo, like another is the therapeutic dose. So both you should be clear. So what is the prophylactic dose if a health worker has to follow this term?
So prophylactic means prevention. So if we look at folic acid, so folic acid is given to prevent neurodevelopmental abnormalities in the fetus, any brain abnormalities in the fetus. So prophylactic dose of folic acid is 0.5 milligram. It should be started 3 months before a woman conceives, and it should be continued till first 3 months of pregnancy. The dose is 0.5 milligrams. Then prophylactic dose of iron, it is 100 mg of elemental iron. So under Government of India, ferrous sulfate tablets are being distributed free of cost to all pregnant women. They are 200 milligram tablets having 100 milligram of elemental iron. Ideally, it should be given for at least 6 months, we say. And it has to be re-emphasized time and again that it has to be continued even after delivery. So there are a lot of changes going on during delivery also, and the woman actually faces these nutrient deficiencies after giving birth. So that loss which occur during delivery in terms of all nutrients, in terms of blood loss, it all has to be replenished. Otherwise, the woman will never experience that sense of well-being which she experienced before pregnancy. So all the losses have to be covered for. Iron and calcium has to be continued for at least 3 months postpartum. Because I'm re-emphasizing it because this is one area we tend to forget to explain to the patients that they need to continue it even after delivery. So this also comes under prophylactic dose.
Yes, apart from these doses, iron and folic acid, the role of diet is not to be neglected, as iron-rich food is very important, and you should know what all are the nutrients which has more of iron. That has to be told, like green leafy vegetables, all dark green leafy vegetable or green leafy vegetables, the whole pulses, then jaggery or good, we can say in simple terms. Then there are another meat, poultry and fish are also rich in iron. So you must encourage the role of nutrition along with the prophylactic doses which are essential for the woman to be taken. Apart from that, you can also intervene with the therapeutic dose. So what is therapeutic dose and why we need to give therapeutic dose?
So the role of therapeutic dose comes when the woman is anemic. What is anemia in pregnancy? Hemoglobin level of less than 11 grams. We take 11 grams as cutoff for hemoglobin level in a pregnant woman. So hemoglobin less than 11 grams means that the woman is anemic. She needs extra iron apart from the prophylactic dose. So a therapeutic dose involves taking 2 tablets of iron every day. That means 200 milligrams of elemental iron. And again, it has to be continued 3 months postpartum.
Yes. And when to refer the woman to the medical officer or the primary health center, because they are working at health and wellness center, which is this at sub-center level or village level. Now they need to be referred to the higher health facility, and higher to sub-center is the primary health center. So when can we refer the woman with anemia to higher facility?
So after we find out that the woman is anemic, apart from giving her dietary counseling, we switch over to therapeutic dose of iron, and we get a repeat hemoglobin level done after 4 weeks. If we find out that the hemoglobin is not improving, or she has clinical signs of anemia showing up, that is, she has a high pulse rate, tachycardia more than 100 beats per minute. Normally our pulse rate is on an average 70 to 80. Or she has breathlessness even on mild exertion, or she has palpitations, easy fatigability, tiredness, loss of appetite, or simply if her hemoglobin is not improving despite giving oral hematinics, such patients should be referred to further higher center for a detailed evaluation regarding cause of anemia and to handle all these clinical symptoms of anemia.
Yes, very important, because this is the most important or most common symptom which we can be find in the antenatal mothers, and you come across these mothers. So you need to identify in case as therapeutic dose has been given and still there is no improvement in the level of HB. At the same time, woman is showing some other breathlessness or tachycardia and pallor. It is continuing, and then this is the right time for you to refer the case to higher health facility. Apart from that, as we have already discussed about counseling during anemia, let us see what is the micro birth planning in case of anemic mother, and their nutritional intervention, as well as there are some incentive schemes which are being given by Government of India, that need to be told to the antenatal mother. So can you tell what is micro birth planning?
So, micro birth planning means timing and scheduling of each antenatal visit. A woman should have this clarity in the mind that when is my next meeting scheduled with my obstetrician or an MO or an ANM, and what all investigations she should undergo and when to show the reports, what are the symptoms which may be red flags for her, when to report to the medical center immediately. So micro birth planning means scheduling each antenatal visit, then chalking out the plan during delivery, which is the nearest healthcare center she should go at the time of labor, and which is the nearest first referral unit, which is a specialized health center she should approach in case of any intrapartum peripartum complication.
Yes, very important. And in the nutrition, we have discussed in detail about anemia. And this is not only for anemia, but high fiber diet or green leafy vegetable. These are very important. Even if the woman is having diabetes or the hypertension, the fiber diet is useful for every kind of antenatal mother. And micro birth planning, as you have told, the day-to-day planning, follow up with the doctor and follow up with the medication, etc., and incentive schemes which are available for the relevant age group should be imparted to the mother, so that she can take those facilities. So today we have covered in the aspects of antenatal care, and we have discussed the component of antenatal care, what is the history taking, what all you have to keep in mind while taking history to identify the high risk mothers, and also about the counseling, in what all area counseling is important. So with this we come to this conclusion, and I thank Dr. Namita for giving us the detailed information about antenatal care. Thank you so much.
Thank you.